Hello friends, welcome back to my channel. Today I am going to discuss with you the role play that is setting is clinic, and this is a known case role play. Okay, so here first three components are important in OET speaking are first is setting, that is clinic, then is nurse role, and the last thing is task. Okay, the scenario is your patient is 51 years old and has had a lesion removed from his or her hand following a diagnosis of squamous cell carcinoma. He or she was overexposed to the sun in his or her teens. You have come to remove the stitches. So this is the scenario, and now the first task is confirm. So from the confirm we can say that it is a known case. Okay, so well, how to start this role play like this? Hello, good morning, Sarah. Because here we didn't ask the name of the patient because it's a known case. We already know the name of the patient. So we can start like this. Hello, good morning, Sarah. My name is Raman Gill and I am here attending nurse today. Good to see you again, and how are you doing? So like this we can ask from the patient, and when the patient replies yes that he or she is fine, then we can reply okay, good to hear that. Well, I am here to clean your wound and redress it. Before we start, do you have any other concern? Because see, the first task is confirm reason for the visit, like removal of stitches, wound cleaning or redressing, and find out if patient has any concern. So we can construct the full sentence like this. Good to hear that. Well, I'm here to clean your wound and redress it. Before we start, do you have any other concern? Now here the nurse say, I am here to clean your wound, because nurse can patient is in the clinic, but nurse can go to the patient to remove his stitches as well as clean his or her wound. Okay, so now the next is second task is give information about squamous cell carcinoma. Okay, so this is the second task, and the bracket points are to elaborate. Okay, like type of the skin cancer caused by the sun exposure, ultraviolet radiation, etc. So now I will tell you how to construct the sentence. So give information, so we can say like okay, when we ask any concern from the patient, and the patient can reply yes that he or she has to know about the squamous cell carcinoma. That means the patient wants to know regarding his or her problem, that is squamous cell carcinoma. Then we can reply to the patient like this. Okay, Sarah, don't worry. I am here to explain you regarding the squamous cell carcinoma. Well, it is a type of skin cancer and it can be caused by some sun exposure or ultraviolet radiation. So, is that clear to you? Okay, when we can explain to the patient, then after that we can also check that the patient is understanding us or not. So we can ask, is that clear or is that okay for you? So we can ask like this. Next is reassure patient about effectiveness of surgery. Example, lesion removed or cancer unlikely to spread, etc. Now here we can reassure the patient so that the anxiousness of the patient can reduce. Okay, so like this, I assure you that the effectiveness of surgery is firstly lesion removal, and another one is with the help of surgery cancer can be unlikely to spread. So are you getting my point, Sarah? Okay, the next point is stress importance of patient skin monitoring. So stress means we can giving some telling something important to the patient. So we can start like this. It is very imperative for you to check your skin, uh, any new or changing spot in your skin, as well as regular checkups are very important in your case. So is that clear to you? Okay, so we can ask like this. And the next third task is resist request for information about patient further surgery. Okay, so in this the point is resist means we can refuse something to the patient, but in OET speaking we can use some phrases to make it polite. So we can say it is beyond my scope. Okay, if the patient can ask us question, we can say your question is appreciable, but it's beyond my scope of practice. Your doctor is the right person to explain you. Okay, so we can say like this. Okay, in this C bracket they can write patient to speak with doctor. So we can speak like this. And another sentence is find out about patient's habits when in sun, like sunscreen or hats, etc. So we can say find out. So we can construct a question like uh, could you please tell me about your habits when you are in sun exposure? Uh, like your sun, are you using sunscreen or wearing hat? So then the patient can reply yes regarding his answer. Okay, so the another task is stress need for ongoing prevention. So we can also say the patient like this. It is very imperative for you that you requires ongoing prevention. In this you can continuously cover up yourself when you are in the exposure to the sun, and also it will help in the prevention of further damage. Okay, so how does that sound to you? Okay, so as like this we can ask from the patient. And another is the find out about the patient wound post surgery. So we can ask the question like could you please tell me about your wound after your surgery? Yeah, what is the condition of your wound after your surgery? Okay, and like any pain or discharge from the wound side. So then the patient will reply yes. Okay, that my wound is healed now and there is no any discharge or pain. So then we can move further towards the next task like emphasis reason why for removal of stitches now. So then we can say to the patient that I would like to tell you that your wound is healed now, and as per your doctor assessment, now we can remove your stitches, and moreover, typically the time for the suture remover or stitches remover is 7 to 15 days, which is in your case. So, Sarah, now is it okay? So I would like to advise you further for your wound cleaning and keep your wound clean and covered as well as dry. So uh, are you able to do that? We can ask that. Are you able to do this? Okay. And in the last is establish patient consent to have stitches removed. So here we can take consent from the patient. So we can say, I hope I have cleared your doubts, and now may I have your consent for or stitches removed. Then the patient will reply yes. Then we can reply to her, okay Sarah, thank you for allowing me to remove your stitches. So thank you. If you have any other query, you can please contact us. I will be happy to assist you.